Various diseases and ailments can now be treated by healthcare experts because of technological innovations. We can now identify diseases much more quickly, keep a closer eye on our health, and take preventative actions to stay healthy or recover more quickly from injuries. Welcome to my YouTube channel. In today's video, I'll be sharing the top 5 medical innovations in 2022. Don't forget to like and subscribe to this channel for more intriguing videos like this, and be sure to watch this video to the end. Without further ado, let's dive into it. What is medical innovation? Equipment utilized in healthcare for treating patients, analysis, therapy, and health promotion is all part of the large field of medical technology. In the healthcare sector, it is utilized to link patient care with technology. From stitches to MRI machines, dental floss to CT scanners, syringes to wheelchairs, MedTech has it all. Biotechnology, medicines, in vitro diagnostics, IVD facilities, and diagnostics at the pharma and biotech level are all examples of medical devices. The medtech industry offers several benefits to healthcare service providers, and advancements result in higher quality patient care. These tools deliver precise results that help therapists create a more successful treatment strategy. The earliest results, such as those from lab tests and scans, are error-free, so patients might see improved outcomes more quickly. Furthermore, medtech equipment and processes save time for both clinicians and patients. With today's technology, procedures can be carried out with less technical complexity. Additionally, medtech offers more effective, cutting-edge, and minimally invasive therapeutic options. Due to its precision, efficiency, and simplicity, it is also a discipline that healthcare practitioners find easy and practical. Now, at number 5, neurotechnology. Neurotechnology is already utilized in the medical and healthcare industries, but it also has significant potential applications for a variety of other industries, like education, business management, national security, and even sports. Neurotechnology covers a wide range of aspects, including visualization and brain function. These aspects include electrodes, computers, and other tools that can block bodily electric impulses. Neurotechnology is currently used in the healthcare industry for brain imaging, which records the magnetic fields created by electrical activity in the brain, neurostimulation, which involves stimulating the brain and nervous system to affect brain activity, and neurodevices, an emerging technology that uses an implant to monitor or control brain activity. Although most neurodevices are still in the research stage, they have great promise to cure brain problems. Neuralink is a prime instance of this. Elon Musk is the inventor of Neuralink, which is creating a device that would be inserted into the human brain and record brain activity before wirelessly transmitting it to a computer. The results of this analysis might subsequently be used to electrically stimulate brain function. If effective, it might be utilized to treat neurological conditions like Parkinson's and Alzheimer's. While Neuralink has so far only tested its chips on animals, Elon Musk has stated that the company intends to begin implanting its chips in people in 2022. While incredibly intriguing from a therapeutic standpoint, neurotechnology is still up for debate. It prompts questions regarding data rights and privacy. Overall, while its potential uses are not yet fully understood, neurotechnology is anticipated to increase significantly in the global healthcare market over the next several years as neurological illnesses and disorders continue to be uncovered and examined. Number 4. 3D printing. These revolutionary printers in healthcare can produce implants and even joints that may be used during surgery. Prosthetics created via 3D printing are growing in popularity because they are individualized and can be built to a person's exact requirements down to the millimeter. This provides degrees of comfort and movement that are unprecedented. Another growing trend is the use of 3D printing for preoperative planning. Surgeons are now able to attempt procedures they previously wouldn't have been able to do because of the use of a realistic model of a genuine patient's anatomy. Through the use of 3D printed models, difficult surgeries can be planned and practiced in advance, which could improve success rates while shortening operation times and recuperation periods. Printers can be used to produce products that are both soluble and long-lasting. The organization, timing, and monitoring of many medications will be made easier for patients by using 3D printing, for instance, to print pills that include multiple prescriptions. Bioprinting is another cutting-edge medical technique that takes 3D printing to the next level. The ability to regenerate skin cells for skin grafts for burn sufferers was first revolutionary, but it has gradually made way for even more promising prospects. Blood arteries, artificial ovaries, and even a pancreas have been fabricated by scientists. The patient's body then grows these artificial organs to replace the damaged original one. Millions of patients who rely on life-saving transplants each year could be saved if prosthetic organs could be made that the body's immune system would not reject. Number 3. Health wearables. Since wearable technology first became popular in recent years, specifically since the release of Bluetooth in 2000, demand for them has increased. Nowadays, people use wearables that are synchronized with their phones to track a variety of things, including their sleep patterns, heart rate, and physical activity. Wearables can be useful in preventing chronic illnesses like diabetes and cardiovascular disease due to the aging population in much of the developed world by assisting patients in tracking and enhancing their fitness. The market for wearable medical devices is still dominated by smartwatches, which are produced by all the big tech companies, including Apple, Google, and Samsung. Depending on the model, they can record electrocardiograms, blood pressure, oxygen saturation, and sleep patterns. Smartwatches with blood glucose sensors are now being developed by manufacturers, which will make it simpler for people with diabetes to manage their condition. Along with smartwatches, other devices such as smart rings, smart garments, and wearables are gaining popularity and are proving to be more and more helpful in gathering data for clinical research. Insidables and implantables are also now being created, proving that technological development is not limited to externally worn devices. The function of organs like the heart and brain has so far been assisted by these internal microcomputers. Many people believe that insidables, also known as smart pills, are the next stage following external wearables. These come in the shape of a hard capsule that must be ingested and transmit measurements, such as glucose levels or images from inside the body to help with diagnosis. Since implantables and insidables are still in their infancy, it is anticipated that they will revolutionize healthcare in the years to come. Number 2. Precision medicine. Precision medicine takes each patient's unique genetic makeup, environmental factors, and lifestyle into account. For instance, a patient with cancer may receive therapy that is specifically formulated for them based on their particular genetic makeup thanks to precision medicine, as it targets tumors based on the patient's DNA, generating gene alterations and making them more amenable to destruction by cancer therapy. This personalized medicine is far more effective than other forms of treatment. Great prospects exist for the future of healthcare to be transformed by precision medicine. While precision medicine is now most advanced in the field of oncology, it also has broader, interesting applications, such as in the treatment of infectious diseases and uncommon and hereditary diseases. Precision medicine will, however, need to be integrated into healthcare, which will be a difficult process given the infrastructure, expertise, and equity challenges that the sector must address before this becomes widely used. Number 1. Telemedicine. Since the COVID-19 pandemic started in 2020, demand for telehealth and telemedicine has increased. While telehealth includes remote non-clinical services, telemedicine focuses solely on remote clinical services. Since the pandemic, more people have adopted new working and living practices. As a result, this trend is likely to continue gaining momentum. By 2026, it is predicted that the global telemedicine market will grow from $68.36 billion to $218.49 billion. Both patients and medical professionals can benefit from telemedicine in several ways. It provides patients with excellent comfort and convenience, and because they are not responsible for any other costs like childcare or travel, it may also be less expensive. Other demographics, such as the elderly, the physically isolated, and those unable to leave their homes, can also benefit from improved access. Telemedicine is also advantageous for healthcare providers since it lowers overhead costs, minimizes the risk of disease and infections, and enables practitioners to visit more patients because they can work more flexibly. Telehealth and telemedicine have become more popular over the past 2 years, and in 2022, technology for virtual appointments will continue to improve beyond one-on-one video conferencing between doctors and patients. For instance, we can anticipate the development of technology that will enable group sessions, enabling numerous patients to be assisted concurrently in response to the expanding number of patients requiring behavioral therapy for mental health conditions. Thank you for watching. Don't forget to like, hit the subscribe button, and turn on the notification bell to watch more videos like this. While you're here, click one of the 2 other videos on your screen to watch. See you later.